Armen Georgian was listening to that press conference with me as well. We're going to unpack all of that, Armen. There's a lot of stuff that came out. No new lockdown, no new curfew. However, there are new measures. Tell us.
Yeah, but first, just to put a sort of question mark or put the no new lockdown in perspective, because although, yes, the health minister did just say no lockdown or curfew, the government's own spokesperson, Gabriel Attal, said very recently, I think it was only about 10 days ago, that a lockdown is not excluded. It's still on the table. So, they're not on the same page in a way. There's some kind of contradiction there. We can't rule out a lockdown, but the speculation was that there could be at least a curfew perhaps announced, or plans for a curfew in mid-December. The health minister's kind of pushed back against that for now, but of course he said other things in the past that ended up being overtaken by events, so we'll have to see about that in the next few weeks. But in terms of the actual changes, so there are a few concrete things: mandatory masks indoors and also at events. So, for example, Christmas markets, which will happen outdoors. So essentially, those social distancing rules are going to be tightened. That's the first thing. The second thing, which is a big step, is the question of boosters and how that interacts with the health pass. At the moment in France, one needs a so-called health pass to do anything, go to a bar, a restaurant, a cinema, get a long-distance train and so forth. And it's virtually impossible to do anything without a valid health pass. Now, the booster shot is going to be integrated into that health pass. So from the 15th of December, people aged over 55 who are eligible for a booster shot, in other words, a third injection, and have not had it, they will no longer have a health pass. So even though they are actually vaccinated, they will be considered non-vaccinated by the system because they won't have had their third shot within the 5 months once they become eligible. The same rules applies to people aged over 18 from January the 15th. So supposing somebody is aged over 18 and they had their second dose more than 5 months ago, on January the 15th, their health pass is no longer valid. So that's another thing. Also on the PCR and antigen tests, which are at the moment the only way for unvaccinated people to join the health pass and be able to do these everyday activities. Until now, the PCR and antigen tests have been considered valid for 48 hours. Now, Olivier Véran, the health minister, says that will be reduced to 24 hours because, he said, of the spread of the virus and this fifth wave. Obviously, detractors will say this is politically motivated and an attempt to put the screws further on the unvaccinated. The reason I said anti, because I was thinking of antiviral pills, Jeannie, which is another interesting thing. There's been a lot of speculation about this pill that will reduce the severity of an infection, stop it, getting into people's lungs and killing them. That antiviral pill will be prescribed by GPs soon and will be available in pharmacies for the over 65. So for vulnerable people, at first, I suppose the way these things go is that they're generally kind of extended to the population at large, but obviously we'll have to see. And just a final point, just to put the figures in perspective. So when we talk about this fifth wave, Jérôme Salomon, the head of public health in France, who was standing next to the health minister there, he talked of the figures at a higher than expected reproduction rate, R rate of 1.35, and over 30,000 new infections this Wednesday. So pretty high rate of infections. But what I think we should keep in perspective is that very few people are dying compared to this exact same time last year. That's an important point to note. The chain between infections and deaths has been severely weakened, if not completely broken. That's something that Jérôme Salomon did not explicitly say, but I think it's important for me to say that to put things into perspective. Of course, what health authorities are worried about is not simply they're obviously aware that fewer people are dying. What they're worried about, I suppose, is intensive care units being overwhelmed. So even people who are obviously not dead but are in intensive care, those numbers are going up, and that is something that these officials, that Jérôme Salmon and Olivier Véran talked about in this press conference just now.
Thanks for that, Armen. The health minister also mentioned children, because the European Medical Association has now said that it is not against 5 to 11-year-olds being vaccinated. In France, Olivier Véran said that kids might get vaccinated, but not before 2022. So that's still on the table.
Yeah, I think that has to still go to an ethics council, doesn't it, to see if they can approve a vaccination for 5 to 11-year-olds.
Exactly. Armen, thank you so much for that.